Hello, everyone. Welcome to the County of Orange COVID-19 Town Hall. Please wait while we wait for others to join the call. And for those joining us on Facebook, thank you for joining us. We'll be holding just for a moment. Please wait while we wait for others. Thank you all for joining. We're the County of Orange COVID-19 Town Hall. Please wait shortly while we wait for others to join the call. Should you wish to join us on Facebook, you can go to the Orange County Healthcare Association or Agency's website at ochealthinfo.com. All right, we'll begin the town hall right now. Good evening, everyone. My name is Molly Nicholson. I'm the Public Information Manager for the County of Orange, and I will be your moderator tonight. Welcome to the County of Orange COVID-19 Teletown Hall meeting. A few orientation items. If at any time you would like to ask a question, please press 0 on your phone's keypad. You'll be transferred to a County of Orange staff member who will take down your question and place you on hold. While on hold, you will still be able to hear the event. We will do our best to take questions during the next hour from individuals calling into the call as well as on Facebook. This virtual town hall is also being live streamed on the Orange County Healthcare Agency's Facebook page at OC Health Info. Again, that's at OC Health Info on Facebook. Joining us tonight on tonight's virtual town hall is the chairwoman of the Orange County Board of Supervisors, Michelle Steele, Vice Chairman Andrew Doe, County Health Officer Dr. Nicole Quick, and Director of County Healthcare Agency, Richard Sanchez. With that, we welcome Chairwoman Steele to provide her opening remarks.
Good evening, everyone. I am Michelle Steele, the Chairwoman of the Orange County Board of Supervisors. We really appreciate you all joining us tonight for this important town hall about coronavirus. First, that I want to stress that most important role that we as an elected people is to ensure the safety, security, health, and welfare of all Orange County's residents, and information the county will be providing tonight is very important that we ask you listen to and take these important measures. We are providing you with the most up-to-date information that we have from the Centers for Disease Control and Prevention, the California Department of Public Health, and from our Orange County Healthcare Agency. It is very important that you follow guidance that we post and will continue to update on this rapidly evolving situation. On the Orange County Healthcare Agency's website that you can see behind me, that which can see on the live stream, I want to stress that the matter is rapidly evolving and the information that will be provided tonight is the most accurate information we have at this time. Again, thank you for joining us tonight.
Thank you, Molly, for the introduction, and thank you all of you for joining us in our Taylor Town Hall tonight. I am Vice Chairman Andrew Doe of the Orange County Board of Supervisors. On February 26th, Orange County declared a local health emergency due to coronavirus, also known as COVID-19. And county staff was then tasked in a special Board of Supervisors meeting with creating a county-wide response plan that the Board of Supervisors will approve on March 24, 2020. In light of Governor Gavin Newsom's executive order today and President Donald Trump's address to the country yesterday, together with the latest guidance from the state and federal health departments, the County of Orange will take the following additional steps to ensure that we adequately address the coronavirus epidemic. Chairwoman Steele and I issued a memo today urging the county executive officer, our healthcare agency, the sheriff department, John Wayne Airport, and human resources to take these immediate actions to ensure the health and safety of all those who live and work in Orange County. First, to cancel all non-essential county meetings and events. Then to ensure effective communication to our employees and the public on a daily basis to update the public on the latest developments of coronavirus, as well as any new status on federal and state guidelines. We will do this through our website and our media updates. We will advocate to our state and federal officials for more test kits and to allocate county resources to process them in an expeditious manner, and also to support private companies, including Quest Diagnostics and LabCorp, in the development and implementation of additional test kits. We will allow county employees to work from home to the extent possible in consultations with their managers. We will allow county managers to take further precautionary steps as they evaluate the ability to reduce the potential of the spreading of COVID-19 in the workplace. We will work to ensure sufficient funding is available for all outreach necessary to reduce the risk of the spread of coronavirus disease in our community. We will pursue all opportunities for federal and state funding. And most important of all, we will prioritize our resources to help our most vulnerable population, such as our elderly residents, homeless individuals, and those with chronic health issues. You can visit my website for the full list at d1.ocgov.com. At the Board of Supervisors meeting on March 24th, as part of the update on the county's response to the coronavirus, I would like to make sure that specific measures that will protect all those who interact with our jails, our homeless shelters, the airport, and all public-facing facilities are identified. We must ensure that the functions of government are carried out while doing our utmost to protect the public's health. Please monitor the Orange County Health Agency's website at www.ochealthinfo.com/novel coronavirus, as well as their social media channels, which is OC Health on Facebook and Twitter. Thank you.
Thank you, Vice Chairman Doe.
Good evening, everyone. This is Dr. Nicole Quick, County Health Officer. Thank you for joining us this evening. A little on COVID-19 or novel coronavirus. Coronaviruses cause illnesses ranging from the common cold to more severe illnesses such as SARS and MERS. As with any newly emerging infectious disease, knowledge about COVID-19 is evolving with time. At this point, it is clear that the virus can pass person to person and cause severe illness in older adults, those 60 and up, and folks with underlying health conditions like heart disease, lung disease, and diabetes. I think the biggest news of the last 24 hours for folks in Orange County is the new guidance on large and small gatherings issued by the California Department of Public Health, also known as CDPH, which indicates that certain gatherings should be postponed or canceled through at least the end of March. You can read the guidance on our website. What's important to know is that this guidance does not apply to activities such as attendance in regular school classes, work, or essential services. We're posting the updated number of cases to our website on Mondays, Wednesdays, and Friday. If someone suspects they have symptoms of COVID-19, they should seek medical care. if necessary, and dial 911 if it's an emergency. Before going to a doctor's office, urgent care, or emergency room, they should phone ahead and describe their symptoms as well as any recent travel history. In addition, they should avoid contact when others when able, not travel when sick, and cover their coughs and sneezes. I would like to give a brief update on what we're seeing as far as number of cases of coronavirus at this time in California. As of this morning, there was 198 cases in California, including 4 deaths. In Orange County, we have 6 total cases, all travel related, and no deaths at this time. I am here with Richard Sanchez, and at this time, we're able to take questions.
Thank you, Dr. Quick, and thank you, Richard Sanchez, for being here tonight. We will now be taking questions from Orange County residents. As a reminder, if you want to ask questions or make a comment, please press 0. This event is also streaming on Facebook at OC Health Info. Again, that's OC Health Info on Facebook. Our first caller is Cam from Huntington Beach. Cam, you're now joining us, Cam.
Yes. Hi. I have a question. My question is, I want to know how many tests have been performed to test patients for the coronavirus.
Thank you, Cam.
So we have been in consultation with hundreds of providers in Orange County to determine whether or not testing is indicated, and have tested numerous individuals. I want to reiterate, we have 5 cases, all of which are associated with travel at this time in Orange County.
Our next caller is Diane from Fullerton. Diane? Diane, are you there?
Oh, yes. I'm sorry. I wanted to know why we are not closing schools at this time, and also why the recommendation is still large groups, like 250, which is an immense amount of.
So let me offer a little clarification on the guidance that's come from CDPH. The guidance states that groups of 250 or more should not meet for those non-essential functions. If there's individuals that are meeting that are of the more at-risk population, those 60 and older, as well as those with diabetes, heart disease, or underlying conditions, then the group size is down to 10. And so that is the recommendation that is coming from CDPH. The recommendations clearly state in there that does not apply to school classroom activities. The California Department of Public Health has issued separate guidance to schools. So at this time, that guidance does not call for school closures in Orange County.
Hi, I'm curious. Yes, I'm curious to know if it's possible to test both our normal type of flu that we see every year and this virus that's going around at the same time.
Eric, can you repeat your question, please, for us one more time? We'll have a bad connection.
I'm curious to know if it's possible to contract our normal type of flu that we see every season and this coronavirus at the same time.
Okay, his question is if we can actually contract the coronavirus and the flu at the same time.
So in general, yes, it's conceivably possible to have 2 viral infections at the same time. And if the question is about how testing is conducted for coronavirus, there are individuals that will undergo testing for both the flu and coronavirus.
Yes, hi. Yes, I started feeling sick last night with a sore throat and a little bit of fever. I went to the urgent care in my city, and they checked and they just prescribed some antibiotics. I feel worse today, and excuse me. And I'm not sure what to do now. I mean, I don't want to go to the urgent care if I have something that is potentially infectious, and I asked that I called the urgent care again, and they said they don't have the testing kit for coronavirus. That I need to connect with the Orange County Health Department.
Thank you, Bernice.
So the way testing is done right now in Orange County is our local public health lab is able to test samples from individuals that fall into some priority categories. Other individuals can go to their private physician and request testing, and that can be done through commercial labs. So for any individual that is concerned about their health, they should contact their provider. If they're concerned about coronavirus, please call ahead and speak to your provider over the phone unless it's an emergency, and then calling 911 is appropriate.
If I could add just, in addition to the information that was provided by the supervisors related to information to the public about what's going on with coronavirus, there's also something called the health referral line. I'd like to give that number out for questions just like Bernice asked. A live person who can speak to the public from 8 to 5, Monday through Friday. That number is 1-800-564-8448. Once again, 1-800-564-8448.
And that phone number, as well as the website where you can get more information, is actually just right behind us if you're looking at Facebook Live in relation to it as well. So now we're going to go ahead and take a question from Kathy in Tustin. Kathy?
Hi, just wondered, they say there's 6 cases. First of all, the presumptive cases have been presumptive for a couple of weeks now. When do they finally get an answer whether they're, how long does it take to get confirmation on that? Secondly, how do you know that younger people aren't showing fewer symptoms and therefore in the county and other older people are getting infected or getting contact with them, and then these are other cases that are unknown, that are not documented? How do you know that there aren't a lot more cases than just 6?
So let me first answer your question about the presumptive positive. Right now, we are testing for coronavirus in our public health lab. When we get a positive result, we have to confirm that with the CDC, and that's what the presumptive positive means. It's until we get the confirmation from CDC, which can take quite a while. We act on the positives in our lab as if it's a positive, so those individuals are isolated. To answer your other question about children, what we know from COVID-19 at this time is that in general, children, particularly under 10 years of age, are not getting severe disease. We, along with several other jurisdictions in California as well as across the country, are doing surveillance to try to get at some of the true infection in our county. So hopefully give us a true picture of how many people are infected.
Okay, Dr. Quick, I actually have a question from Jacob Amata. And his question is, how many hospitals in Orange County are equipped with test kits? Do we know what the breakdown is between South and North County?
Yes, to answer that question, once again, the only labs in Orange County that are conducting the COVID-19 testing is our public health lab, as well as the commercial labs of LabCorp and Quest, which are not just Orange County labs, those are nationwide. Doctors' offices do not have test kits. Those tests are run either at LabCorp, Quest, or at the public health lab.
And we're going to take another question off of Facebook. This is from Rudy. His question is, what do you think about rideshare drivers, Uber, Lyft, etc.? Is it safe for them to continue working, seeing that they pick up and drop off from JWA, Long Beach Airport, LAX, etc.?
So 2 comments on this. The CDC has issued guidance directly at transportation. And once again, I want to reiterate that the California Department of Public Health information that came out to us about mass gatherings does not apply to public transportation.
Yedida, are you there? Hello? Okay, we're going to go on to the next caller. This one is from Melissa from Mission Viejo. Melissa, are you there? Melissa?
Hi.
Hi, I'm here. Thank you for taking my question. It's twofold. My first question is, why are numbers only being released Monday, Wednesdays, and Fridays? And why aren't actual numbers of those tested being released, which is being done in San Diego County? It's very difficult for us to judge whether it's safe for our kids to go to school if we don't know how many people are actually being tested and get prompt notice of those results.
Sure. So as far as the Monday, Wednesday, and Friday, that is what we have determined works as far as our workflow process for releasing lab results. As far as the number of tests run, when we have commercial laboratories that are testing for COVID, what we get reported to us is the number of positive cases. And so while we run lab tests in our lab, there's also commercial labs running tests, and we are only aware of the positive results that come from that. Thus, we are reporting out the positive results in Orange County.
The next question is from Justin in Laguna Beach. Justin?
Hi, I'm calling because I actually think I should be tested. I was at a music festival in San Diego over the weekend, and I tried to call. I saw a doctor as instructed by the hospital. I was tested for the flu. It was negative. The doctor said I was viral, but she had no sense of where I could go to get tested. I had an appointment at Quest today, and they do not take specimens in order to test for it. And I'm a loss for what to do, and I'm confused on why this has been going on for.
Justin, it looks like we lost you, but we can talk about the test kits in general.
Once again, comments for the public that's concerned, the health referral line that you can see behind us, you can speak to a live person by calling that. And I would also urge individuals to call their medical provider or go see a physician about testing.
Okay, so this question comes from us from Facebook. This is Kenneth Yashida. Excuse me if I'm destroying your name. I appreciate it, doctor. Can you comment on the technical issues that the media were reporting with the CDC test kits 1 month ago? Has that issue been resolved to your satisfaction?
So we currently have test kits that have been approved for our use and are not having any difficulty running the test kits in our public health lab at this time.
The second question that the doctor has is how many test kits are run each day in the county, and is there a site where the medical community can follow contact information for tracing purposes?
So the information that we're releasing publicly is on our website, which is behind us, which has our case counts with some information about travel associated and so forth. And what was the second part of the question?
The second part of the question is how many tests it runs each day in the county. Is there's a site where the medical community can follow contact information for tracing purposes?
So I would refer to our website for the information we're releasing. As far as number of tests, that depends on how many people under investigation we have in on any given day.
Molly, if I could add, to relay any concerns that we don't follow up on cases, we have a whole team of staff who follow up on both cases that positive and suspect cases. In addition, we follow up on individuals who may have had contact with those individuals. So while that's not outward facing, and realize that we're dealing with privacy laws related to health information, that we are following up on that, and providers who need to know are made aware of that as well. So we are having communication with the health provider community, both the doctors, the hospitals, but much of that is behind the scenes. And there's an earlier question about the schools. If there was an event at a school, then definitely we would make sure that there's an awareness of what happened at that particular school. That has not happened in Orange County.
Once again, for those that are just joining the call right now and would like to ask a question, you may ask a question by pressing the number 0 on your dial pad. For those that would actually like to watch it live streamed on Facebook, you go to Facebook at OC Health Info. Again, that's OC Health Info for more information to ask questions on there, and we will be capturing some of those questions and asking them tonight to the representatives here from the healthcare agency. The next question I have is from James in La Habra. James?
Hi, my question is related to the people from the faith community. Of course, there's going to be several assemblies held on Sunday at local churches and rather large assemblies. What special message would you give to our local faith community people in churches as to what action they should take for church services on Sunday?
So the question is about faith services and what recommendations you would give to the faith service community in relation to COVID-19.
Sure. So the guidance that came out from California Department of Public Health applies to groups of 250 or larger, or if you have individuals at risk. So those 60 and older, as well as diabetes, heart condition, any underlying medical condition, that this guidance applies to groups of 10 or more for that group. Once again, those guidance, I would urge people to look at that. If you go to our webpage behind us, you can link to that document and read it. There are measures that individuals can take to protect themselves, and these are basic measures that everybody can take, and that is, if you're sick, please stay home, cover your coughs and sneezes, wash your hands frequently, and once again, we always take the opportunity to remind people to get a flu shot as well.
For those that are on the call that are experiencing some technical qualities in relation to it, there is a backup phone number for you to call. You'll just be, if you already obviously in the queue, you probably want to stay on this line, but if not, the phone number is 888-987-3602. Again, 888-987-3602. And the last time, 888-987-3602. So our next question is going to come from Facebook. And it's a question from Aaliyah Gerard. How are you coordinating with Los Angeles and Riverside counties, who are both reporting cases of community spread? How do the nearby community spread cases impact risk assessment here, which is still listed as low on the Orange County Healthcare website?
Sure. So we absolutely coordinate with our partners, and that's at the federal level, state level, as well as jurisdictions in our surrounding area. So we are in continual contact with public health officials from those areas to make sure that everyone sort of has that situational awareness of what's going on around us. Second part of that question was? Let me go back to it. Sorry.
The second part of the question is, how did the nearby community spread cases impact risk assessment here, which is still listed as low on the Orange County Healthcare website?
So to answer this question, I would say that we are continually reevaluating what the risk is to residents in Orange County. And once again, we have 6 cases, no cases of local transmission. We are monitoring this every day and getting information out. The best way to get our most up-to-date information is follow us on social media, as well as to reference the website that you can see behind us.
Ryan?
Hello, can you hear me?
Yes, we can, Ryan.
My question is, when you were speaking regarding the presumptive test positives that come from the local test in your local area that get sent to the CDC, you mentioned there was a bottleneck. What is the average wait time with the presumptive test coming back if they are positive or negative?
Thank you, Ryan.
I wouldn't describe a bottleneck. We don't wait for the presumptive positive final result from the CDC to take any action. So we take complete public health action based on our local testing capacity.
I'm just looking through the queue right now, Dr. Quick and Richard Sanchez, in relation to it, lots and lots of questions about schools. And I know we've answered this question before, so but people who are joining us on the call, the major question is, when are we closing schools? When should we pull our children out of school? Can you possibly just speak to all that? Because I obviously have a lot of people in the queue with that question, but I want to make sure we can answer that question in total.
Yeah, I want to reiterate, and maybe individuals who have joined us later in the call, the guidance that came out from CDPH relating to mass gatherings applies to gatherings of individuals greater than 250 or 10 if it's at-risk population, and CDPH clarified that that does not apply to school-based classroom activities. CDPH has previously issued guidance for schools, which is still in place. Right now in Orange County, we do not have a case of COVID-19 in a teacher or a student in the county at this time.
And just for the record, for people that don't know what CDPH stands for, that stands for the California Department of Public Health. They are the state agency that does public health issues. Obviously, the County of Orange works closely with CDPH.
Molly, if I could add to that, almost all of our activities here in Orange County are driven by Centers for Disease Control at the federal level, and then down to the state, California Department of Public Health, and down to the locals. So we follow the guidance of both those entities, CDC, CDPH, for consistency, as Dr. Quick mentioned, in response across the nation. So I just wanted to make it clear that this isn't like an Orange County decision we're making here. However, we are responsive, we're boots on the ground to make sure that the response is carried out.
The next question is Jessica from Tustin. Jessica, are you there?
Yes. Hi. As a parent of a child with asthma, should there be precautionary measures I should be taking for my child? Like, should I consider homeschooling just because she has the what would be categorized as a pulmonary illness?
If I understand the question correctly, for parents of children who may be at increased risk of infection, what I would suggest is talking to your private physician about that risk assessment. But I want to reiterate that schools in Orange County have been given guidance from the state and are adhering to that guidance. And at this time, we do not have an indication to close schools in Orange County.
The next question is from Graham from Irvine. Graham, are you there?
Yes, hi, thank you. Can you hear me?
Yes, sir, we can.
Yeah, so two questions, a two-part question. One is, I don't think you were specific about how many testing kits are actually available in Orange County. I know you've mentioned there's been 6 cases, but how many testing kits are actually available? And the second part of that question is, because Dr. Fauci today said that there's a failure to deliver testing kits, so I don't know how many are available in the county. And the second part is, while you are following guidance.
So to answer the question about test kits, we have sufficient test kit supply at our local public health lab for the time being. We do not have a shortage of our test kit supplies. Once again, want to reiterate the commercial labs of Quest and LabCorp have also begun testing in Orange County, as well as in California. To answer the question about what LA is doing in their schools, that's not something I can speak to. Once again, we are following guidance from the state, as are our schools, and right now we do not have a case of COVID-19 in our schools in a student or a teacher.
If I could add, I'm sorry, if I could add, Molly, that we are following the guidance of the state here in every county in the state of California. However, that doesn't stop any particular school district, any private company, any venue from taking their own action. And I'm like Dr. Quick, I'm not sure what's happening in Los Angeles County, but know that decisions are being made locally because the directive that came from the California Department of Public Health officer was to the residents of California, all residents of California, not just the local health agencies. It was to the entire state, for the entire state to be ready to respond to this illness.
Again, I'd like to go ahead and plug for all the people that are on the call. Obviously, you're very interested in this issue. Please go on the Orange County Healthcare Agency's website. It's ochealthinfo.com/novel coronavirus. Again, ochealthinfo.com/novel coronavirus. You can also go find them on Facebook, which is at OC Health Info. Again, at OC Health Info. As you can imagine, we have a multitude of calls tonight. So if we do not get to your call, we'd ask that you go on Facebook and go ahead and leave your comment if you can. We're trying to batch up some of these questions to make sure we answer all of them. Again, we've answered a lot of questions relating to schools and differences in regard to it. Richard, would you mind talking about what the issue of guidance means as far as that's concerned? You kind of touched upon it in your last call. Obviously, it's kind of a little bit more of a government term, so I want to explain to some of the people on the call what that might mean to them.
in guidance with state directives, or excuse me, not directives. Let me clarify. A directive versus guidance. Guidance does not have the force of law or force of enforcement. I would say in this situation, though, in addition to guidance that we got from the state, as the public already knows, Governor Newsom issued an executive order, which did kind of give us directive on this particular outbreak because of the pandemic nature of it. So we did get somewhat of an order on this one. That is unusual, but the guidance allows us to give us individual subpopulations, for example, schools, jails, homeless shelters. What is the guidance across the best practices that are being seen, that are being pushed out by the experts in those fields to respond to those populations? It helps for a uniform response and a uniform approach across the nation.
And I know many of you are going to want to read those documents in particular. You can find the California Department of Public Health's information on our OC Health Info website. Again, that's ochealthinfo.com/novel coronavirus. Please go there. There not only is information about any guidance documents that might come down from the state, the Centers for Disease Control and Prevention, but it also has a lot of great flyers. So any callers that are calling about your faith communities or any of your schools or anything along those lines, there's information not only in English, but in Spanish, Mandarin, and other languages on there for you to use and pull down. We suggest that you would take those down. Feel free to post them to your, email them to your groups, your friends, print them out. It has information about people who might be hoarding and getting information, how to self-quarantine. There's a multitude of information that you can help arm yourself with and also share with the rest of the community here. So you guys are on this call because you care deeply about it. We hope that you take the information, share it with your neighbors and your friends and your loved ones in relation to this. So with that, I'm going to go back to a question from Facebook. Her name is Joanna Lee, and this is the question from her. Is the OC Healthcare Agency working with adult daycare health centers in Orange County to ensure that older adults who participate in community-based adult services are being monitored for possible symptoms and making sure that the older adults are not at risk in group settings and when being transported to and from the center?
So we are absolutely pushing out the same message that we have been talking about this evening to those facilities as well, as this guidance applies to them. We have specific guidance to older adults in the form of an infographic and informational pamphlet on our website. I would encourage everybody to look at that. It talks about what individuals can do to protect themselves while going about their essential activities.
So our next question, Bethany in Laguna Beach. Bethany, are you there? Bethany?
Hi, hi, sorry about that. I hate to belabor the point, but I just have more questions about the school. I understand that kids are not as susceptible and you don't have any cases from the schools yet, but they are capable of spreading the virus and they don't really show symptoms from what I understand. So that means that they can get infected and then they can infect their parents and it goes up the chain to elderly members of the family, elderly teachers. What is it going to take to close the schools? I mean, Los Angeles, all the private schools have closed. From what I understand, San Francisco, and you're saying that California is not closing schools, but I think San Francisco has closed them. So children with it and that's spreading it that are asymptomatic. It's very alarming.
Thank you, Bethany.
So once again, I want to reiterate what I said earlier, that while children may become infected, we have not seen serious illness in children, particularly under the age of 10. To speak specifically at what other jurisdictions are doing, what schools and other jurisdictions are doing, that is not something I can speak to. Schools do not need permission from public health to close. So whether or not schools are closing in other jurisdictions may not be at the recommendation of public health. We very much rely on the guidance of our State Department of Public Health, and relying on their guidance right now, we do not have a case in a child or a teacher in Orange County and thus have not recommended any school closures.
Molly, if I could add, what I'm hearing and what I'm getting from the gist of these conversations is a lot of concern surrounding schools and children. And I totally understand that. That is completely understandable from what is viewed as a vulnerable population. Please know that our school districts are all uniform. We typically work through OC Department of Education to message out. They have a medical director. They have a person who specifically, her work is regarding health of the children. Dr. Quick has talked to her. We've talked to OCDE. We are doing what we can to protect that vulnerable population. So know that those activities are going on.
All the callers that have called in tonight, please know, just as Richard Sanchez, he's the director of the healthcare agency, has responded, we do hear you loud and clear on the school children in particular. We are taking note of that information. We'll make sure that we work in coordination with the Orange County Department of Education, which we already do, to obviously pass along some of your concerns related to that, okay? So it's very important. I know all my parents on here are very concerned. We do understand your concerns. We do hear you at this time. However, we want to obviously answer some questions that come from a broad spectrum. So if we haven't answered every question related to schools, we need everyone to understand that we do hear you. We will work to obviously help with some messaging related to that, okay? So I do have one question off of Facebook. Her name is Miriam. How is our county addressing concerns related to the homeless population in Orange County, especially with regard to hygiene recommendations from health agencies?
Yeah, so we have, the healthcare agency is reaching out to partners across the spectrum, including homeless shelters, with guidance on how to keep the facilities hygienic and what individuals can do to help prevent the spread of any respiratory illness, including COVID-19. So that is absolutely one of the one of the stakeholders that we are working with.
And if I could add, we have staff at the healthcare agency that's specifically working in what's called infection control, stopping the spread of disease. We had them go out to the shelter, speak to them on how they can implement infection control procedures. We've given them guidance, so know that we are aware that that is a population that needs to be watched. As I said it in response to an earlier question, we realize that there's subpopulations with specific needs, and we are addressing all of those subpopulations.
And again, we have, if you want to go on Facebook and watch Facebook Live in relation to this, you can go on the Facebook page for the Healthcare Agency of Orange County. That's at OC Health Info. Again, at OC Health Info. You type that into your box in regard to Facebook. It'll pop up. You can also find us on Twitter that way as well, okay? Our next person is, Kathleen in Irvine. Kathleen, are you there?
Yes, I am. Thank you so much. So wanted to address, as established by Dr. Tony Fauci on the first coronavirus task force meeting that they had, that this is asymptomatic. And so therefore, someone with COVID-19 might not be sneezing and coughing. And so therefore, what are we doing about our healthcare providers and the citizens in terms of masks? Aerosolized. I have friends that are in South Korea. They all have masks, and that's a big, huge part of decreasing spread. And I know there seems to be a lack of masks. I try to buy them myself. So thank you so much for addressing that. I really appreciate it. And God bless everyone here, and God bless Orange County. Thank you.
Thank you, Kathleen, for calling.
So to address a couple of the points that you made, we do know that some individuals who get COVID-19 will be asymptomatic. This is the whole spectrum from asymptomatic to severe disease. Luckily, the vast majority, up to 80%, get mild illness and will fully recover on their own. As far as masks, the recommendation for general public is that a mask is not needed and may or may not be effective at preventing disease. When we talk about our healthcare workers, what we try to ensure is to make sure that healthcare workers have the appropriate personal protective equipment that they need to protect themselves in those high-risk encounters with individuals. And so we do not have a shortage of PPE for healthcare providers at Orange County at this time.
Okay. We have a question from Jack from San Clemente. Jack, are you there?
Hello.
Yes,
yeah,
Jack?
hi. that I'm in the at-risk category above 60 or so. I mean, anyway, at the high-risk category, we would like to know what cities, these 6 cases that are referenced on, broken down on the website, these 6 cases, what cities are they in specifically in Orange County? Because, you know, I can adjust my daily life around areas, and I'm going to have to do that if this keeps spreading. So I'd like to know what cities they're from, please.
Thank you, Jack.
So the information that we can release for individuals is available on our website. We do not release cities where our cases are, nor does that particularly matter to the individual. It is not considered an encounter, even if you were to walk by somebody who is infected with COVID-19. It takes sort of a prolonged personal contact to potentially be exposed. I also want to reiterate, I would urge everybody to go to our website and look at the information we have on how individuals can protect themselves. And we have one geared exactly towards individuals that may fall in that high risk category. Information on there as far as avoiding any non-essential group gatherings, as well as covering your coughs or sneezers, staying home when you're sick. That information is on there and is really an important public health intervention for everyone.
And again, I want to remind those that have joined the call, should you like to ask a question, please press 0. We're very close, about 15 minutes out from the end of this phone call. As you can imagine, we're not going to be able to answer everybody's phone call at this time. However, we ask you to go to Facebook and go to OC Health Info. Again, on Facebook, OC Health Info, please. Our next question is, our next question is coming from Joseph in Buena Park. Joseph, are you there?
Hello? Can you hear me?
Yes, Joseph, please.
Yes, my name is Joseph Campos Jr. I'm a resident of Buena Park, California. My question is, for people that own pets, I mean, does this disease, is it strictly for humans, or can it transfer to our pets? And if so, what kind of treatment can we give our pets if it is transferred to them?
So as far as evidence of pets having it, I have probably read the same case report that you all have seen in the media. I don't have any more insight to offer other than that. If you have a specific concern about your animal, I would suggest talking to your veterinarian.
Our next question comes off of Facebook. It's from Jeanette Monroe. Is it safe to have dental work during this period of time?
Absolutely. I would urge everyone to continue with their medical visits and dental work as planned. If you are ill, then it's a good idea not to go in for those unless it's an urgent visit. So I would urge everyone to continue with their normal medical care and dental care.
Our next question comes from Lou from Mission Viejo. Lou, are you there?
Thank you. Yes. Earlier today, LA County leaders and public health officials recommended postponing or canceling events that attract more than 50 people. My question is, why are we in Orange County not taking a more proactive approach, considering the proximity between Orange County and LA and the fact that many Orange County residents work in LA and vice versa?
What do you need?
So as far as speaking to what LA has done, I'm not in a position to do so. We are relying on the California Department of Public Health's recommendation. And once again, I'd like to reiterate that document can be found on our website. But just for anyone who may have joined later in the call, that guidance that went out to everyone in California is to cancel mass gatherings of 250 or more people and 10 or more if it's that high-risk population. Those 60 and older, anyone with diabetes, heart disease, or underlying medical conditions.
We have a question from Facebook from Lori DiCarlo. What coordination is taking place between city and federal representatives at this time?
So we work closely with our federal, state partners. And if the question is, are we in communication with our city officials? Absolutely.
Molly, if I could add, there's something in county called the Emergency Operations Center. And the owner of that is the Orange County Sheriff's Department, who runs what's called an operational area, which is pretty much Orange County. We have instituted communication on a weekly basis with all our partners, with all first responders, cities, the county, pretty much the stakeholders in this space, to make sure that everybody is on the same page. In addition, there will be more announcements further coming on how we push information out on a more regular basis.
We have two questions about John Wayne Airport, which is under the county's jurisdiction. So I'll have David from Seal Beach ask the question about John Wayne Airport. David, are you there?
Yes, I am. I have a two-part question. Should are passengers arriving at John Wayne Airport being screened, and if not, should they be screened for the coronavirus?
So currently, passengers arriving from certain countries are screened at specific airports. John Wayne Airport is not one of those airports. As to the question of policy around returning travelers, that is a decision that takes place at the federal level.
So our time is almost up, and we have time for just about one more question, possibly two, okay? Before I get to the last question, I give our audience a chance to get more information on COVID-19 on the Orange County Healthcare Agency's website. Again, that is www.ochealthinfo, all one word, ochealthinfo.com/novel coronavirus. That's spelled NOVELCORONAVIRUS. I should get a spelling bee award for that one. So if you want to go there, there's the most up-to-date information on there about COVID-19. There's lots of handouts. There's lots of flyers, particularly from my families that are calling in, my parents that are calling in regard to their kids. We have an adorable flyer that's on there that actually has, what's her name, Dr. Rita, that's on there, that has a little zebra. Talks about hand washing techniques and such. I would highly encourage that you take a look at that, give it to your kids in a non-scary manner to teach them about hygiene and washing and proper techniques in relation to that. Please pull that down and feel free to share it. So I'm going to go with our last question on this. Where am I going? This question is from Mina in Irvine. Mina?
Hi, this is Nina. Can everyone hear me?
Yes, we can, Mina.
Hi, great, thank you. So I had some symptoms yesterday. I had a fever and a cough. I called my healthcare provider, and my healthcare provider indicated that I didn't fit the criteria and directed me to the health referral line that you just identified. Also, I called the health referral line, and I was told I don't qualify for a test. So I feel that I exhausted my resources. I'm in contact with a fairly large number of elderly adults, and I want to get tested, but I don't know what else to do.
Thank you, Mina.
So once again, I want to briefly cover testing in Orange County as of right now. Our local public health lab that's part of the healthcare agency can test for certain people, and those are the highest risk populations. Both Quest and LabCorp, which are commercial labs, can test based on a doctor's order. So if an individual has called our health referral line and doesn't qualify under our criteria, the only suggestion I have is to talk to your provider talk to your provider once again to get a lab order for the test to be done by Quest or LabCorp.
Molly, no, that's fine. These microphones are something to deal with. Just to be clear, then, we only test for the individuals that meet the criteria as given by CDC and the state. Your private doctor can order a test for you, but it has to be a doctor's order to get that test. So that is the route to take if you don't meet the criteria under our guidance, which is on our website.
Again, that website, very important for everybody on the call and on Facebook today. That's ochealthinfo.com/novel coronavirus. Has all the information that you can need as far as the latest up-to-date information. It's updated by our public information officers over there at HCA, the healthcare agency, daily. So please take a look at it. There's also, if you are interested in follow on Twitter, you can follow OC Health Info on Twitter, OC Health Info on Twitter as well. You can find out the latest information from them on Twitter should you feel that. Facebook, the county, all of our departments are obviously working in tandem to ensure we get the proper information to everyone. So we have time for one last question. This is going to be about youth sports from Roy in Fullerton. Roy?
Hi, everybody. Thanks for this town hall meeting. This is awesome. I have a question now. With Disneyland, some of the major businesses like this closing down till the end of the month, so far I've seen one youth sports league in Fullerton suspend play. What is the county doing over city jurisdictions about youth sports where, like in Fullerton, we have Lions Park and Basketry Park, where obviously, unfortunately, there's homeless population that is coming around. A lot of times the bathrooms are not equipped properly with soap and other type of sanitary products for us to be safe. Is the county going to mandate or looking to mandate cities to suspend youth sports leagues, or are they going to help them make sure that they're a safe environment for the kids?
Thank you, Roy.
So once again, this guidance that came out from the California Department of Public Health and then subsequently reinforced by the governor went out to every Californian. And so the healthcare agency is relying on this guidance, and that guidance really applies to everyone in the state. As far as the county's role in enforcing that, this once again is sort of a directive that came from the governor to everyone in California. If you had specific concerns about a bathroom facility within a jurisdiction, I would recommend reaching out to that facility in particular.
And once again, I want to remind everybody where you can find all the information. I'm probably going to sound like a broken record. Again, OCHealthInfo.com/novel coronavirus. Again, that's OCHealthInfo, one word, .com/novel coronavirus. You'll be able to find a multitude of information from the federal government, which would be the CDC, the Center for Disease Control and Prevention, to the state, which is the California Department of Public Health, and obviously everything from the county here. So we are monitoring things from the federal level, the state level, and obviously international level, watching who is doing as well. So this is obviously a very large issue. I know many of you are concerned in relation to that. Please stay tuned. Look at the website on a daily basis if you're very interested in what's going on over at the healthcare agency and what your county is doing to ensure your safety and the safety of your loved ones in the county. So we're coming to a close right now. Obviously, we have been working nonstop here at the county. We want to make sure we have an outlet for you all to talk with us tonight. Please know we didn't get to all your questions tonight. We know you have a multitude of questions. My parents, we hear you. My folks that are in the 60 in age bracket up, we hear you. People are concerned about you, school leagues and everything else. We want to make sure you have an outlet to talk to your county. So we encourage you to go to Facebook again, put your comments on there, and you can come talk to us as much as we can. We will try to interact as best we can. As you can imagine, the public information officers at the county, such as myself and others, are looking and monitoring as best we can to make sure we address your concerns and your needs. This is why we did this phone call tonight. So again, we are at the end of tonight's virtual town hall on COVID-19. Again, Orange County residents, you are encouraged to go to OCHealthInfo.com and follow Orange County Healthcare Agency on Facebook at OC Health Info and on Twitter at OC Health. It's OC Health, guys, not OCHealth.com, info rather. Thank you for joining us all. Thank you for joining us all tonight, and have a good night.